So good morning, good afternoon, and good evening. Welcome to the 1574th day of continuous and uninterrupted Zoom session of IFPH. Let us start today's program with a silent prayer for 1 minute. Thank you and welcome back. Today we have with us Dr. AADITI LAKSHMANA BHMS, Diploma in Homeopathy, International Academy of Classical Homeopathy, Greece. The topic is evidence-based homeopathy, the need of the hour. Definitely is the need of the hour. On behalf of IFPH, and welcome, doctor. You can have the platform for the next 45 minutes, followed by we have a discussion for 15 minutes. Thank you. Please proceed.
Okay, thank you, sir. So let me just start by sharing my screen. Yes, sir. Can you see? Is it properly visible?
It started screen sharing. Yes, visible now. Okay.
Okay.
Yes, please proceed.
Yeah. So thank you for this opportunity, first of all. So my topic for the day will be evidence-based medicine in homeopathy, which is the need of the hour. So the main goal of to build a. So I just want to start by introducing myself. So I'm Aditi, and I've done my BHMS from Government Homeopathy Medical College, Bangalore, and yeah, so let's dive in. First of all, I just want to give you a clear-cut idea about what are the things I'll be speaking about. First, I'll be starting with introduction to evidence-based medicine. I'll be defining what evidence-based medicine means, why evidence-based medicine is important, for the present day world scenario. Then I'll be going through what are the levels of evidence that is available, and I'll be talking about the research pyramid. Then whatever evidences are there so far, we'll be seeing that. And what are the problems due to which homeopathy is not accepted among the scientific community? We'll be throwing some light on that. And what we can do as a homeopathic physician. So we'll be talking about that as well. And later on, we'll be going towards the case report writing and, how we can collect good high quality evidences. And also, I will be concluding by telling the groundbreaking study done in homeopathy. So please, stay until the end. So I'll start by introducing evidence-based medicine. So the definition of evidence-based medicine is that it's the integration of clinical expertise, the patient values, and the best research evidence that's available at the moment. And why evidence-based medicine matters for this current day scenario is because it builds credibility and acceptance among the scientific community. It enhances trust and confidence among patients. It helps improving clinical decision making. So when I say it helps in strengthening integration, what I mean is evidence-based medicine makes it easier to integrate homeopathy into mainstream healthcare system. For example, like there's cancer case. There are a lot of cases which allopathy or the conventional medicine is not able to deal with. In that cases, we can still integrate homeopathy as a palliative medicine or palliative approach. So having a proper evidence-based medicine in homeopathy will help in integrating with the mainstream healthcare systems as well. And also, most importantly, it'll address the skepticism that there is around homeopathy. So by aligning with evidence-based medicine principles, homeopathy can counter the common criticism of lacking scientific validation. So what we hear about homeopathy is it's just placebo, it doesn't work, it's just water. These are the things we hear, but actually when we practice, we see that it can bring cure like anything, like, it can help in psoriasis cases, it can help in cancer cases, it can help in depression. It's not just placebo, So having this evidence-based medicine will strengthen that is available in the scientific community, that is even as a part of the conventional medicine. First and foremost, there is systematic reviews and meta-analysis. Second, there is randomized controlled trials. Third, there is cohort studies. Fourth, there's case control studies. And fifth, there is case report and expert opinions. So this actually we study in the community medicine as research pyramid. So if you're like remembering, this pyramid was there in our SPM textbooks. So as we go up the pyramid, the quality of evidence become more and more stronger. That means that compared to an expert opinion or a case report or case series, systematic review and a RCT, like randomized controlled trials, have higher quality of evidence. And as you go up the pyramid along the triangle, the quality of evidence rises up. The risk of bias also minimizes, which means that when you take an expert opinion, I can tell whatever I want. I may be biased. When you take a case report or case series as well, you can be biased even while giving the remedy or while you are trying to tell the findings that you have. But when it comes to systematic reviews, the risk of bias will be minimized. So this is the research pyramid. I will quickly go through what is like in homeopathy. So the first one is systematic reviews and meta-analysis. So how we define this is it basically summarizes multiple studies to give a comprehensive overview, like whatever is available until now. You can even take a particular period of time or particular remedy, particular disease condition, but it will give a comprehensive overview. So for example, combining results from 10 studies to conclude whether Arnica montana is effective for treating injuries. So this is one of the examples that I can give with respect to homeopathic perspective for a systematic review. Like this, many papers are available, but I'm just giving you a small example here. So when it comes to systematic reviews and meta-analysis, it is the most highly reliable form of evidence, and the risk of bias almost becomes minimal. Second, we have randomized controlled trials. So most of you may be aware of this. How we define RCT is participants are randomly assigned into different groups to test a particular treatment. For example, testing if homeopathic remedy belladonna reduces fever compared to a placebo. So basically, the patients will be taken and put into random groups. We'll have single-blinded study and double-blinded studies as well, depending on the study of the design of the study, basically. So what we do is we are just allocating people into different groups, and then we are studying, whether homeopathic remedy belladonna reduces fever or not in comparison with a placebo. So at the present, RCTs are considered like the most good quality level of evidences, even in conventional medicine. Third, we have cohort studies. We define cohort studies as observing groups of people over a time to study the effect of a treatment or a particular condition. For example, we'll track patients using homeopathy for allergies over 5 years. So this is like this, you can go over different conditions, different remedies, different time periods. So this will give you an observation. Next, coming to the case control studies, we define case control study as comparing patients with a condition to those without to find common factors that is there. For example, in homeopathy, we investigate if patients with eczema who used homeopathy had fewer relapses compared to others who didn't use homeopathy. So this is the one of the simple example that I can give for case control studies. Am I too fast? Do you want me to slow down? Okay, so moving on. Next one is case reports and case series. This is very important to us, my friends. So, for as a homeopath, each and every one being a homeopathic physician, we can do this. So, case reports and case series. How we define a case report is it's a detailed report on the outcomes of treatment in individuals or small group of patients. So, when we study a individual person, it becomes a case report. When we are studying a group of people, small group of people, it becomes a case series. For example, reporting on a patient with migraines improved using individualized homeopathy. This is one of the example for case report that I can give. So this, in short, I try to summarize what the research pyramid and levels of evidence carries. So now, as homeopaths, for homeopathy, what are the evidences that are available so far? Many RCTs have been published. Many observational studies have been published. Many case reports have been published. But yet, it's not acceptable as scientific evidence. Why is that? Does somebody want to shed some light? I want this to be a little more interactive. So many studies have been done, like about RCT. There's so many observational studies. There's so many case reports. Why do you think homeopathy is still not acceptable as a scientific evidence? These things. So I'll just go ahead. The main problem is the lack of uniformity. So, one of the main strengths of conventional medicine is that they have a greatest advantage, and that is uniformity in treatment. But we know that as homeopaths, each patient is unique, each patient is individualized, and we are giving, tailored treatment to each person. And although disease conditions may be same, we are still giving different remedies. So in homeopathy, we lack this requirement to bring about reproducible result. What it means is that, okay, somebody had fever, somebody had typhoid, let's say, I give bacteria. I cannot give bacteria to everybody who has typhoid. Each patient has a different unique picture at the time of fever or typhoid. So what conventional medicine does, anybody having fever, they give paracetamol. It's generalized. But in homeopathy, we can't. So that is a very big problem to conduct RCTs, because there's lack of uniformity. Even the RCTs and the systematic reviews that show homeopathy in good light are not considerable because of this one big flaw. Therefore, we must bring forth more and more evidences of the same kind that speaks for classical individualized homeopathy. So when I was going through, a lot of papers, whatever is already available online, homeopathy, there are a lot of schools that's agreeable, but there's so much lack of uniformity in the practice. What Hahnemann says and what we are practicing, there's so much difference. There's so much difference in the perspectives that we carry, and some people giving single remedies, some people giving multiple remedies, some people doing polypharmacy, and all of this is on internet. All of these are published. There's completely lack of uniformity. There's no particular standard to say that, okay, the this is a high quality evidence. So this, my friends, is a main problem. So I'll go over. So right now they say that, RCT is the most important evidence. But for homeopathy, I personally feel, after, reading, that homeopathy cannot be, we cannot be adopting RCT into homeopathy. So why? I will just explain what I feel, my thinking. First thing is that homeopathy is an individualized treatment. Homeopathy is highly personalized. So, what is the problem that there is? RCTs require standardized intervention. I'm sorry. Yeah. So, the RCT requires standardized interventions, which does not align with the individualized nature of homeopathy. That's what I explained to you. You can't give bacteria, or you can't give arnica to everybody who has injuries. So that is one of the biggest flaw. Second thing is placebo controlled design. What we have in RCT is one group of people will be receiving remedies or medicine, and other people will be on placebo to try and compare. So it's difficult as a homeopathic practitioner, or for homeopathy in the design, to establish an inert placebo group. Remedies are often individualized, making it challenging to create an universally applicable placebo. Then third thing is there's a lot of blinding issues and risk of bias. Double blinding is really complex in homeopathy because practitioners will definitely know the remedy that they're prescribing, and there is, it can influence the trial outcome. Fourth one is long-term observation. So RCTs basically are generally short-term. They will keep it for a specific amount of time. Whereas, being a practitioner, you yourself being a physician, you would have noticed that, sometimes any chronic condition can get cured in 3 months. Sometimes it takes years, depending on the level of the health, the genetic predispositions that one person is carrying. So we cannot generalize saying, okay, the person, when we give the remedy, he has to get a result within this particular time itself. It's, it is not possible. So that's also one of the major flaws, that results may take time to manifest. RCTs are often short term and unsuitable for evaluation of chronic conditions, especially in long term homeopathic treatments. So this is also another flaw. Then the next one is patient centered approach. So we as homeopaths know that we just don't treat symptoms, we focus on holistic healing, and we focus on the unique symptoms of an individual. But RCTs actually evaluate only specific outcome. They ignore the broader outcome. For example, if I give paracetamol, what it will do on fever, that's all they want to study. But when we give a remedy, it's not just fever, it's making the energy of the person better. It's maybe even taking away the headache, it's taking away the cough, one single remedy. So this aspect cannot be covered with RCT. And next one is the most important one, ethics of withholding treatment. So there's a very big ethical concern in placebo control groups. Now, you know that the patient is suffering with a chronic disease. One set of people will definitely be receiving the remedies, which is a case group. In control group, people are having, like, they are having a chronic disease, but you're meant to be giving placebo. So withholding effective treatment in chronic or severe cases raises ethical questions in the trial design, which means you're not treating them, they're actually suffering. And one more thing is that we know the Kent's observations. We know when we give a remedy what may happen. When you don't give a remedy, nothing will change. But when you give a remedy and then you call the patient for a follow-up, you know that okay, something has changed, whether the remedy is right, whether the remedy is wrong. So that definitely does not go well with the RCT, because physician knows that whether remedy is given or not. When you give placebo, nothing changes, right? So that is a very big flaw, that we cannot fit in homeopathy into this RCT concept. And there's also dynamic prescriptions. So we would have seen in our practice that there are layers in a case. Basically, remedy changes as the patient evolves and we take them back towards the road of cure. So this RCT fails to capture that adaptive nature of homeopathic prescriptions over time. So these are the reasons why it's still not we are not able to really establish homeopathy as to that level of evidence that other conventional medicine people are able to do. So this is something that we really have to look at. So what can we do? Now we saw, okay, these are the levels of evidences available. We know that homeopathy is getting criticized and there's not enough scientific evidence, although it's in good light, but then we are not able to really, make that benchmark. So one important step to take as a homeopathic physician is that we are not just clinicians, we are not just physicians, but we are also a clinical researcher by ourselves. So when you study a case, let's say you're studying the case of psoriasis, you need to know in depth about the pathophysiology of the disease, how it occurs, what is the normal presentation of the disease, how this patient was come to me with psoriasis, how is he different, how is he unique in this particular disease as well. So this is one important thing. And second thing is, after you know these things, you have to focus on documenting case very, very meticulously. When did it start? How did it start? What aggravates it? What was the past history? What was the family history? What was his personal history? Everything need to be documented, because each case is a learning opportunity and it will add to the bag of level of evidence for homeopathy. So you have to meticulously document these things. This will make you improve yourself and also for the benefit of homeopathy. The third important thing is publishing cases and case series. So once you've documented case, which can be published as case series or cases. So I'll be talking about that, which is good enough to be published. And most importantly, we as a homeopathic community, it's very important to follow the Hahnemannian, homeopathy, what the master has taught. We should not deviate ourselves from that. I personally believe that, because after going through so many case reports, so many RCTs that they're available, so many papers that's available, each thing is talking something different. Uniformity does not mean in the remedy that we are prescribing, it's in the methodology that is being taught by the master. So maintaining uniformity as a homeopathic community is utmost important, and yeah, that is the prime thing at the moment. So now, my friends, I'll be talking about what is a case report. So we as a homeopathic physician, we are not researchers, or we are not sitting at different we don't have that position maybe to conduct RCTs or something, because it requires a certain setup and then funding and all. But we, in sitting in our clinic as a physician, what we can do is to publish case reports, to treat patients, and of course pick those cases which have done really well, and then give that as case reports. So what is a case report? The case report is a research design where an unexpected or novel occurrence is described in a detailed report of findings, clinical course, and prognosis of an individual patient. So when it comes to a case report, we'll be talking only about one patient, one disease, or whatever. But generally, it'll be a one patient. When it comes to case series, a case series is a type of observational study that tracks and documents outcomes from a group of patients with a specific condition. So something will be in common. Let's say you treated 3, 4 cases of eczema. So what did you find in that? Now eczema becomes the common line. Or you treated like hundreds of cases of allergic rhinitis. You saw that sabardilla is coming up as one of the primary remedies. So that will become the common topic. So there'll be something that will be anchoring this, group of patients. Either it should be the disease condition or the approach or what was the outcome that you observed. Something will be common. So that time it becomes a case series. So it involves a detailed presentation of several individuals, often to highlight similarities or differences or potential effects of a particular intervention. So this is case series. And before we go ahead to, write a case report or, case series, one very important step is that we must take informed consent from the patient. It's very, very important. So different journals, wherever you are publishing, will have different formats. So ensure to download and get it signed. Take the consent of the patient. Now, how to write a case report? First and foremost, we must identify which cases can be published. You cannot publish any case that you treat. There are certain criterias. So the criterias are as follows, like, there must be an unexpected or unusual presentation of a disease. There must be like new, either one of the things, I mean to say. There could be a new association or variation in disease process. The presentation, diagnosis, and or the management of new and emerging diseases, like something new came up, new disease, you treated it and it worked, you can give that also as a case report. There will be unexpected association between disease or symptom, like something commonly it is not observed, that thing you observed, those things also can be taken up for publishing. An unexpected event in the course of observing or treating a patient. And the last thing is finding the pathogenesis of a disease or an adverse effect when you are treating the case. So one most important thing is there are some diseases which will auto resolve even without treatment. So when you're treating a case, you must be very well aware of the pathogenesis, whether you give a remedy and then they're already on some allopathic medications as well. So you should also differentiate whether allopathic medication has, conventional medicine has cured the case, or whether homeopathic medicine has really impacted, or just it auto resolved. So generally there is something called, you can publish this case reports for free. There are some sites which provide it for free, and some are peer reviewed journals. So generally when you publish it in a peer reviewed journal, it will cost you some amount, but it is a good quality evidence, because a lot of people among the scientific community will be reading, and also the impact factor will be higher. So it's a very good level of quality of evidence. So we need to differentiate whether the condition can auto resolve or whether really in the case homeopathy has made an impact. So for this, we need to be very much aware of the pathogenesis and the homeopathic principles as well. Moving forward, regarding the case, once you have regarding the case report writing. So once you have already identified that, okay, this case is good enough for publishing, what are the aspects that one can take care of? How to write a case report? So the key parts of a case report are generally you would have seen in papers, most of you. So there'll be an abstract and keywords. So abstract basically contains whatever is there in the paper in short, they will give it to you. And there'll be keywords. So when you search it on Google, no, those keywords pick up. Then there'll be an introduction for a case report. So in the introduction, what you will be writing is you'll be writing regarding the condition. What is the definition of the condition? What is the types? What are the pathogenesis? How do we diagnose the disease? What is the treatment modalities available? And what is the scope in homeopathy for this particular disease condition that we are treating? So this will consist your introduction. You'll be basically providing an introduction to the disease condition. The third important part of the case report is you'll be having a case presentation. So you would have read in your homeopathy, like colleges and all, right? We used to have that case presentation. So we'll be like, telling the history of the patient, how did it start, and what was the patient taking, was he taking anything else, and why did you choose homeopathy production? Then you important for the case, you can tell how the disease was diagnosed and outcome. So in this case presentation, you'll also be talking about what you prescribed, why you prescribed, and also you can make a follow-up table, like there'll be a proper you have a date, and then what happened, what did you give for this particular, you can make a table. So all this comes under case presentation. So explanation of the case history and the follow-up, and the outcome. Then we have a discussion. So now, see, just because you have treated something doesn't mean you can go and publish it. There must be something striking, right? So that striking element you will be putting it in the discussion part, where how it was different in the epidemiology, or how it was different in the pathophysiology, how was it different from any other case, the similar case condition, how was it different in this particular case, like either in the diagnosis part or clinical presentation, your treatment, whatever was there which was away from the common finding, those things you will be discussing in the discussion part. And then you'll be writing a small conclusion saying what is it that you concluded through this uh, case report. And also you'll be attaching the references. So this is a altogether different learning to write a case report. But in general, these are the things any homeopathic doctor can do easily with whatever is available. So right now, the journals that are available for publishing in homeopathy, for homeopathy is these are the few very good impact factor. And when you publish it there, the whole scientific, it provides a good quality of evidence as well. So the first one, which is the IGRH. Second, we have Time. It's called Homeopathy. Third, we have American Journal of Homeopathic Medicine. Fourth, we have Homeopathy for All. Fifth, we have International Journal for Homeopathic Sciences. So these are all available on Google. So these are some of the things that I found. So the journal, then we have Journal of Alternative and Complementary Medicine. We have Complementary Therapies in Medicine. There's European Journal of Integrative Medicine, Journal of Evidence-Based Integrative Medicine, International Journal of Complementary and Alternative Medicine. Yeah, and also there's something called HPathy where, even without a fee, you can publish. So you can go to their site and then, like you can provide, you can just read the author guidelines. And then if you're able to do the case report by yourself, you can publish as well. So what is the path ahead for us? What I feel is that we have to encourage collaborative research initiatives, and we have to find good funding for high quality studies. That's most important, because in homeopathy being an individualized system of medicine, it's very important that we have high quality studies and education and training in evidence based medicine for homeopaths. So this is the need of the hour, my friends. So what I feel is that everybody is practicing, but you're practicing in your clinic, definitely you will have success, you have fame, if you're helping patients, but your contribution towards the homeopathic community to be you know, uh, to be telling that homeopathy has a very good scientific evidence-based medicine, and also get trained if you're interested for it. And it's very important that if you have good collection of cases, which you can strongly say that no, this is not auto resolution of the case, but homeopathy has really impacted in that particular case, you can publish it even in peer-reviewed journals. So peer review journals is where there's a team of reviewers. They will go through the paper. They will judge whether really homeopathy has helped or not. So I would like to bring across this groundbreaking theory. So there's a groundbreaking research in homeopathy, the study which the homeopathy community has been waiting for 200 years, and I don't know if this has been come across more evidently. So there's a lot of controversy regarding the proof of action of homeopathic remedies. So this paper really highlights, and it's a very 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 big evidence, I would say, and any homeopath who's really passionate about the subject must read and try and understand what this means. So this paper is called The Spin-off Electrons and the Proof for Action of Homeopathic Remedies. So I'll just read the abstract. In the last 200 years, the action of the highly diluted homeopathic remedies has been proved by their curative effect on the human organism. In this work, a hypothesis concerning the mystifying question about this action is proposed. The hypothesis suggests that any pathology, either functional or structural, can be detected in the change of of the overall energy of the human body. Such energy is constituted by fields of force according to the quantum physics. More precisely, every disturbance of the human organism affects the spin on electrons of different elements within the human body, and their reset could take place with an agent similar to the electromagnetic force that created the problem. This statement has been proved by the correct homeopathic treatments, as it can be seen in many published cases. The hypothesis is based on two approaches: the idea of the specific relevance. So I'm just reading the abstract. The paper itself is like it's really good. It takes some 2 3 readings of understanding. To the best of my understanding, I will be able to tell you. So this study was done by Professor George Vitilkas in Camellia. And this is considered one of the most groundbreaking theories in homeopathy, which a lot of people are not aware of. But it's like something that every homeopath has to read and understand the depth of it. So, what the paper concludes is that, needless to say, if this hypothesis proves to be correct, the whole concept of conventional medicine concerning disease and their cure will have to be changed drastically. The question, of course, remains: how could this change in the spin of electrons be detected and measured in a laboratory? If there's such a confirmation, namely that a disease state is producing a change in the spin of electrons, and the cure results only after we are able to affect the subatomic level of the vital force with a similar agent of an electromagnetic nature, we will have revolutionized medicine far as the diagnosis and the cure of disease is concerned. We can then say that we have really entered the epoch of energy medicine where homeopathy belongs. So I would request everybody to go back and read this paper. You can just take a screenshot. I will just go up so you can note the name of the paper, and you can it's easily available on Google as well. So please read this paper and then see how it functions exactly. So, in simple, if I have to say, think of our body, what the paper says, this is my understanding. Think of our body as a radio tuned to a specific frequency for a good health. When we get sick, it's like the radio station gets distorted and goes out of tune. Like, when you're tuning it, if you're not in the right frequency, it goes haywire, right? Like that. This theory says that homeopathy works by gently helping the body retune itself. Even though homeopathic remedies are diluted, they carry information that interacts with the body at a very tiny level, like the spin of an electron. We are all made of atoms, right? So it will be interacting with the body at a very tiny level, like the spin of electrons, which are the tiniest building blocks of the matter. These electrons influence the body's energy balance, like fixing the signal on a radio. So when you take a remedy, it's basically it fine tunes, like a radio. When you go to closer towards the cure, then when you go towards closer to the frequency, you can hear a good music. In simple words, homeopathy helps the body fix itself by restoring its natural energy balance, just like fine tuning the radio back to clear music. So this is what I understood. If I have to explain in simple words. So what I would like to, before I conclude, I'd like to show you some examples of case series that's already there. Just a second. So here is an example of the patient consent form, which I was talking about. Even before you actually, go ahead and publish a case, it's very important that you take consent. So here is a sample consent form. This is by BMJ Journals that I put it up. So it basically contains the name of the patient and whether if you're using any, like, let's say it's like psoriasis or eczema or something like an injury, some part of the image of the person or some report you're using, you basically blur their eyes, and then you also blur their name. And yeah, this basically contains that. And that patient has consented for the use of publishing. That's what it means. So this is just a sample. So you get it signed and keep it for your reference. Now, secondly, I'll be showing you an example of case report. So this is the case that I have treated and I have published on Hpathy. So this case report is basically a case of idiopathic facial nerve palsy managed with classical homeopathy. So this is the title of the case report, and then here I have photos. So basically I've blurred it because we have to maintain the confidentiality of the patient, privacy of the patient. So, like I said, just go through in your mind what exactly this means. So, first I told you there will be an abstract. In the abstract, if you look at it, I'm quickly giving like a short description about what has really happened in the case report, like what has happened in the case. So here I'm talking about Bell's palsy, what exactly it is, why managing it, how it can be challenging, and why allopathic medication may not be used in such a young child. These kind of things are being put, and also I'm giving a short description here if you see that I'm giving what exactly I've done in this case. It's a 14-year male patient with Bell's palsy, and then he took he took conventional medicine, and then it didn't work. He took different medicines and it didn't work. And what were the symptoms? This will basically contain the abstract. In short, you'll be describing what exactly the case report is saying. Then we have keywords. So these keywords are very important. When you put it on Google, it will pick up. Then we have a background or introduction. So like I told you, introduction will be containing, the definition. If you look at here, there's definition of Bell's palsy, and there'll be incidence and epidemiology, like incidence and, what is the exact pathogenesis, how it, disrupts the transmission of signals. Then we have types of facial palsy. I'm explaining it here. So basically, I'm giving an overview of the condition. Then how diagnosis of Bell's palsy is generally done and how it is managed in conventional medicine. And if you look at here, most patients with Bell's palsy experience full recovery within few months of appropriate treatment, but they need ongoing management. In this case, in spite of taking those medications also, he was not improving. So this differs from how generally the presentation. See, what it says is generally people recover, but here is not recovering. So this stands out to be publishing. Then we have case report. So here we'll be talking about like a short description of the history of the presenting complaints. What were the symptoms available for prescription that was there, past history. Then there's family history, diagnosis. And in this part, you'll also be talking about case analysis and prescription. Like what was your strategy of prescription and why you gave certain remedy? What was your prescription and dosage? So you can also like attach a repertorial image, if you're writing it for the homeopathic community, it'll help understanding. And what was your prescription like, what was given, whether it's one dose or few doses. Then you can put a follow-up table where what were the symptoms each time the patient came. You can mention the date, you can tell what are the significant symptoms that were there, and you can also provide an analysis whether remedy is correct, that's why we don't have to change it at the moment, and just say prescription. So like this you can make a follow-up table. Next and most important part is the discussion. So this is the follow-up table. I had a longer follow-up, so I have put it up. So coming to the discussion, what happened in the case? So Bell's palsy is typically a temporary condition, and most people experience a full recovery within few months to few weeks. Although in some cases symptoms can recur. But here, in addition, the visible symptoms of Bell's palsy can lead to stigma and misconceptions about the condition, further exacerbating the social and emotional challenges experienced by affected individuals. See, when there's a condition, it's just not the condition. It's like, patient also develops a certain anxiety, or they feel that they're dependent, the sadness, depending upon the severity of the condition. So, in order to address all those things also, such cases may benefit from classical homeopathy by minimizing the impact of residual symptoms and quality of life. So here I'm talking also about the levels of health concept. You can read about it online. And I'm applying the same concept here. And also, my friends, there's something called as the modified Naranjo criteria for homeopathy. It's called the Monarch Causality Assessment. So this is basically a table which I'll be showing it to you. This will basically tell you whether there is a correlation between the treatment and the observed outcome. For example, I gave homeopathic treatment to Bell's palsy case, right? So when I fill out this table, the score actually reflects whether homeopathy is really affected and it really impacted the case to cure, or was it just allopathic treatment, or was it just auto resolution. So this is very important. You can look it up online. I'll show you exactly how this is the modified Naranjo criteria for homeopathy, Monarch table. So this table basically contains certain questionnaires from homeopathy and scientific point of view. So was there any improvement in the main symptom or condition for which homeopathic medicine was prescribed? If it is a yes, you score it 2. If there's a no, you put it -1. If you're not sure, you put it 0. So this is the scoring. So for the score in the case, I'm putting it here. Did the clinical improvement occur within a plausible time frame? For example, when you give a drug, when you give a remedy for fever, you should see instant improvement, within like 24 to 48 hours at least. If it is a acute, you need to see improvement. You can't give the remedy now and expect you see the changes after 1 month, and then you can't say that there's a possible relationship between the remedy given and the outcome observed. So this one is very important. It'll be helping with the homeopathic causality. Was there any initial aggravation of symptoms? So this is also very important. If it is a yes, it was observed in the case, you put it as 1. Did the effect encompass more than main symptom or condition where other symptoms ultimately improved or changed? So what this actually means is you gave treatment for hypothyroidism, but the patient also had migraine, cold, cough. So did the treatment, that whatever you gave, just treated hypothyroid, or it also addressed the other issues? The patient had sleeplessness, loss of appetite. These things also did it address? So if it is yes, you put it 1, and you just go according to the questionnaire. And then this also has direction of cure. This is very important. This basically, this table contains everything that goes in line with the classical principles of homeopathy that were jotted down by Hahnemann, Kent. So direction of cure: did some symptoms improve in the opposite order of the development of symptoms? Very important, according to the Hering's law of cure. And also, the second part is direction of cure. Did at least 2 of the following aspects apply to the order of improvement of symptoms? Which means, like, from organs of more importance to those of less importance, from deeper to more superficial aspect of the individual. Like, like something of mental or emotional symptoms were there, and then there was physical symptoms. So did it encompass, like, the deeper aspects got better, and then the superficial aspects? And then from the top downwards is also, like, basically pertaining to the Hering's law of cure. And next is also one of the most important questionnaire: did old symptoms reappear temporarily during the course of treatment? So we would have generally seen that when you give the correct remedy and then the patient is down to the road of cure, you generally see that old symptoms start reappearing. So this also means that homeopathic remedy is actually happening, and there's an active therapeutic process. And the eighth question is: are there any alternative causes that with a high probability could have caused the improvement? For example, in Bell's palsy case, they say that within like few weeks to few months, it will auto resolve on its own, even though you don't take any treatment, or you take considerable amount of treatment. So for me, in this case, that was yes, because he had already taken allopathic medications, and it took some time after I gave homeopathic remedies as well. Was the health improvement confirmed by any objective evidence? So objective evidence means it means that it can be photos in cases of skin diseases. It can be scales, like there are some scales to measure each outcome. There are laboratory reports, like you saw that okay, TSH was 10, 11, and then after treatment you have it as 6. So these comparisons, this basically is the objective evidence that okay, you can confirm either through laboratory evidences or photos, like this. So in this case, there were photos available of the patient. Wells phenomena was there, and then the palsy also. So this is a 2. And did repeat dosing, if conducted, create a similar clinical improvement? For example, you gave the remedy and then you repeated the remedy. Did it create a similar impact? So basically, this is a whole score of 13. This case showed 9. So which means that almost, there is a good causal relationship. there's a significant causal. So for each score, you can go and look it up online. There's a minimal causal relationship. Like that, there are different ways you basically grade them. So 9 out of 13 means, it basically means there's a significant causal relationship between the treatment and the observed outcome. And then you basically write a small conclusion regarding what you saw in this case. It will help in managing, and further studies are needed to confirm the findings. These kind of things can be written in the conclusion. And here are the references. So this again is a whole new learning, which I'll not be touching upon. So here, basically, we treated diabetic foot case. There are two cases of diabetic foot treated with classical homeopathy case reports. So basically, this is a case series. So similarly, even in case series, it's going to be like you have a keyword, abstract, then you'll have a background or introduction. And when it comes to the case presentation part, basically you go about telling case one, and then you present the whole case one, like how we did in a case report, like past history, local examination, what was the intervention. Then you give a case two. Like this, you can go up to like 4, 5, 6, whatever, is there. So you split it up like this: case one and then case two, there may be case three, like that. So in case presentation part, case series will slightly have a different way of writing. So I'll just go down.
Yes, Doctor, we need some time for discussion, and I hope that we can have it's a big subject, and you're discussing about many things which are very, very important to see how it works, whether the homeopathy is scientific or not. But we need a evidence-based presentation at all times. So let us conclude the session with
Just allow me 2 minutes of time. I'll be
yeah,
concluding.
yes. 2 minutes of time, then
Yeah,
we
this
can
is the
have a
last thing I'll be
discussion.
concluding. Next slide is
Yes,
concluding.
yes.
So here we'll be providing the discussion, and then, like I said, you can also provide, modified. This score is very, very important to say, whether the case that you have treated really has been impacted by homeopathic treatment, or whether it was just an auto resolution, or because of certain other treatment modalities it has gotten cured. And there'll be a conclusion and references. So I will be concluding. Just a second. Yeah. So to conclude, I would like to conclude by saying evidence-based medicine is essential for the growth and acceptance of homeopathy. It's the prime important thing at the moment. And overcoming challenges through vigorous research and innovation is very, very important. And I would like to encourage you all to meticulously document each and every case. See, there's so much effort that goes behind, taking a case and helping the patients. So as much as possible, try and document the case properly. Like I told you, what are the things that may be needed. So you can study the disease condition, and then you can document it. And then if you're not able to do it on your own, you can reach out to me or to somebody who's knowledgeable about these things. So to call for action, I would really feel that we as homeopathic physicians, we need to embrace evidence-based approaches for a brighter future of homeopathy. So by saying this, I would like to conclude and open the floor for questions and discussions.
Yes. Thank you, Dr. Aditi. It's really a very, very classic presentation from you at this webinar session. Anyway,
Thank you.
it is a time for discussion. Dr. Manoj will be the first person. He is one of our leading doctor who has done undertook so many moderation in our team. Most number of moderation in our English session, and he not only that, he is a retired voluntary retired doctor from Homeopathic Medical College at
Saradarshna, not
at-
voluntary return for the time being. Okay, thank you, Dr. Tanesh, for your invitation. And Dr. Aditi, is a nice presentation, and we are happy to see the young talented persons really performing well. But unfortunately, majority of our doctors always complaining that we don't have enough research studies, but nobody is in fact willing to listen this. if this is a program based upon some medicinal clues, definitely the participant will be 80 to 100. But it's a wonderful process, more than substantial one, but only around 30. What it indicates? Who is the culprit? None other than ourselves. Then you mentioned about this reproducible results. And we often know that the statistical studies are often some sort of tampering is there. We have witnessed a lot of studies on the coconut oil in performance with palm oil. Then what happened? It is totally utter failure. The studies were. It is fabricated. Then about the COVID vaccine, the last one, the latest one.
Correct.
They,
Yeah.
they claimed it is effective in pregnant women within 4
Correct.
months. How can you study a vaccine in 4 months in pregnant women? So it will take at least 1 year or 9 months to conceive and deliver. Then the child must develop to 3 years. So minimum 4 years is needed. But
Correct.
these scientific fraternity accepted the same in 4 months.
Yes.
So my advice is that we don't be so obedient. We should have our own mechanism. Then also our councils should accept and forward to this other. So though no court can challenge it. Even the
Correct.
National Council is accepting, nobody can challenge it. Because the judges, they don't have the technical expertness. So dare to be wise. Thank you.
Yes, yes, that's rightly.
Thank you, sir.
Yes,
So,
this is as Dr. Manoj pointed out, we need such kind of studies based on our principle and our methodology, rather than the methodology proposed by the so-called modern people. Frankly, Dr. Prakash Rao, one of the senior most researcher in the homeopathy fraternity, has presented so many sessions in this forum. I must say, more he has done the most number of presentation in connection with the research in this paper. Tomorrow also he will be presenting a session, the effectiveness of homeopathy in managing plants and animals like that. So all these things are recorded in a specific way. He has the Central Council of Homeopathy has put forward certain guidelines upon which we can directly go for research work, and we can manage the cases and we can put into the scientific community. That's why they are asking all the doctors to upload at least a single case in their website, so that will be reached to the public. And that's what the need of the hour. As you rightly point out, the evidence-based homeopathy is the need of the hour, and that we have to present in the website of National Council of Homeopathy itself, so that the world will look into that, whether is it anything true with homeopathy. The so-called bogus people, they are saying that it is unscientific, and they are just telling the world that homeopathy is a pseudoscience, but it is not. We have the evidences. More than 2.5 lakh homeopathy physicians are here in India. If each of one put forward at least one case, the evidence will be 2,50,000 like that. So this is what is the time. Everyone need to come forward with such cases. That is why the International Forum for Promoting Homeopathy is working hard to bring an uninterrupted session every day with this 3 languages now. That is, the purpose is not for getting any of our personal belief, something, but instead to promote homeopathy, to show the world that homeopathy can do such and such thing. So if you look into the videos put forward by International Forum for Promoting so far, you can see so many so many unbelievable cases cured with, particularly in the field of autism, cancer, infertility, all kind of. If you have any kind of, even in arthritis, whatever may be the case, you can see so many presentation in the YouTube with the International Forum for Promoting. That is the purpose.
Amir Malik, Dr. Sunrising and waiting.
Yes. I have seen. But anyway, this is what I want to tell. And now I invite Dr. Amir Malik. He's from Pakistan, a legend from
yes,
Pakistan.
sir. Thank you for the opportunity.
Hello,
Yes. Thank you,
greetings.
sir. Thank you for the opportunity.
Greetings and namaskaram to honorable doctors and special grand thanks to honorable Dr. AADITI Lakshman and honorable Dr. Danesh, honorable Dr. Manoj, our all seniors. Have a great day, blessed day. God bless you, all of you. I'm very impressed by the today's session of Dr. Aditi Lakshman. It's a very great and the first step to be EBM, evidence-based practice. It's a very big thing in homeopathy, and I think so. It should be essential for all doctors from the whole world to make our root deep in the world, because that we are not scientifically giving evidence, this is wrong. Pathological reports, plasma reports, there is a big change within the cells, neutrons, nuclear level. What is the basic pharmaceutical basis of our homeopathic medicines? If we follow the EBM, we also follow the genetics. We also follow what is the difference in genes and genetic levels in the polarity of the cells. On the basic four transition, translocation, addition, and deletion, four basic molecular levels of genes and genetic is also very important. We should submit all the EBMs when we have practiced with the help of homeopathic medicine system, because there is a mafia who don't allow us to come number one in the world. Because my belief is that number two is always number one. So homeopathic is number one in the world. But your lecture, Honorable Dr. Aditi, it's a very important step. I request you again and again, please, you may come, you give and guide the doctors how they can overcome on the scientific level to boost the homeopathic medicines and our way of treatment in the world. Because this is not a pseudoscience, it's only mafia criticism against our homeopaths and our system of medicine. So I totally agree. Today, I'm very happy to see such a great result, a research work from you, Honorable Dr. Aditi. I'm very happy. God bless you a lot for this. And you may come again and again. This is our prayer. And always for homeopathy, the words are not enough to praise homeopathy, to praise our guru, to praise our seniors, to praise IFPH. IFPH is the world number one material medical in future. I'm telling you. You can see there are a number of doctors. You can't believe how they are working and miraculously healing the patients, which is including the all departments, all chronic ailments which are syndrome in the world, but they are curing by the homeopathic medicine system. So we appreciated always the efforts of all doctors, all our seniors, and the IFPH, the International Forum Promoting Homeopathic. It will be a leading platform in the world, and it is now lead the world now. It's a great thanks to God and great thanks to honorable our doctors with a lot of love.
Thank you, Dr. Malik, sir.
God bless you, all of you.
Now
And
it's
a lot of love to all doctors.
Thank you very much, sir. Now it is the time to wind up the session. I invite Dr. Harihan sir to say a few words as well as the vote of thanks to the session, sir.
Okay, okay. Thank you, Aditi Lakshman. You are lecturing regarding certain facts about the research, and it is very, very correct. Yeah, and we always say that evidence-based homeopathy that I am still approving. But even then, there is a problem. Usually, we homeopaths face. That is what is that. Suppose a patient is coming to us as polylithiasis. See, the patient is having severe pain and severe discomfort. All the symptoms of polylithiasis he shows. We give the medicine, individualize the patient and give the medicine, and the patient is getting relief and patient is happy. And suppose if we take the ultrasound scan, we can see that stone is there. They want to know. They want to know about the stone, not the comfort of the patient, not the comfort of the patient. But patient says, I am okay. I have no discomfort. All the symptoms have disappeared. But evidence-based means, see, we want to show that how that medicine acted and whether that stone is there or not. They say that the stone is there, but the patient says that I am okay. See, we homeopaths face, in certain cases, we face such condition. So this is these are all facts regarding research. And anyway, you are lecturing regarding this research, certain facts you said. It is very, very correct. But you, it is for your knowledge. I said the example. The patient says that I am okay, but the scientific community then they did not approve that.
Okay.
Sir, eventually, the right remedy is given, the stone also will reduce in size. There are a lot of examples about, immediately if it's an acute, situation, the symptoms get better, the energy of the patient gets better. But the stone per se takes some time to break down, and the patient would have roamed over all the places, they would go to conventional medicine, Ayurveda, etc., come to us. So we have to undo the side effects those treatments have done and still, carry,
Yes, sir. Yes, sir.
we have to do best.
We
Yeah.
have to wind up the session now. Sir, you can say vote of thanks, sir.
Doctor, on behalf of IFPH members, office bearers, and the doctors attended, I would like to say the vote of thanks. And you are a budding good doctor. You have a very fine future. Come again, doctor. Thank you very much.
Thank you. And I
Thank
also
you,
would like to gratitude to my teachers, and thank you, IFPH, for this opportunity. Thank you so much.
Thank you, Eric sir, Dr. Manoj, and those who attend the session. Tomorrow we will have a session from Dr. Prakash Rao, and sir will be talking about the research work in homeopathy for the treatment of animals as well as plants. So with that, we come to the end of the day 1574. Thank you, Aditi, Dr. Aditi, once again. It's over to Dr. Mariam Majon to moderate the Malayalam session.